So this is David. David's coming in today because he has this swelling just anterior to his right ear. You can see it here. It's sort of mobile. There's a couple things with this. We put some anesthesia underneath it. So what we're going to do is just open this up subtly and then sort of see if we can extract whether this is a cyst or small lipoma that's there. All I would tell you is here, in front of you have to be careful. There's a branch of the external carotid artery that comes up this way. You have to just keep in mind the fact, though, that these structures lie in the skin proper. So we're talking about the dermis and the hypodermis. So we're not going deep to those areas, so you should be okay. Same thing up through here. The facial nerve comes out and then branches through his whole face. We shouldn't be dealing with any of that stuff because we should be staying very superficial. Now, from a practical standpoint, the other problem we'll have with this area is it's not like dealing with the skull where the skull's right behind it and that pushes lesions out. So here, because it's more soft, it's going to move on you a little bit. So we may have to sort of, get this out in pieces. We'll sort of see how that comes out for us. All right, so David, again, that doesn't hurt at all? No pain there. So the other point here is, again, because this isn't infected, we should have good anesthesia here. So David, if you feel anything at any point in time, just let me know and I'll just add some extra anesthetic for you. So these are the curved Cryleys again. So I like those just from a blunt dissection perspective. And if we're not open enough, so you'll see how that doesn't give to any great degree. It's open but just a little bit, so it's not quite there yet. So when I get that, I just switch back and add a little bit more. As long as you progress slowly, you should be fine with this. Shouldn't be a need to rush it. And that doesn't hurt at all, David? So you can see there how it opens up from the epidermis perspective, but I'm not getting deep to it. So I have to go a little bit deeper with the scalpel. So there you can see now, you can appreciate that. That looks, you can see that little area. See how that tissue type is a little bit different? That's what we talk about when we talk about something that looks pearlescent. And that's what you want to see, because that's what the cyst capsule looks like. So you see how that opens up differently? So you see now how I'm a little bit deeper. Now I can get right down into it. So you should be able to appreciate that right there. That's the cyst capsule that's there. So if you put some pressure on it, just like that. And now I can appreciate it. That's the cyst that's sitting there. So that's most of the capsule that's there. So you can see where it's open, but you can still see you can grab that capsule that's there. Make sure we get the rest of that out. Still not hurting to any great degree, David?
No.
So we'll use in this case when 90% of the capsules come out and you're just dealing with remnants. use a small curette. Just to make sure I cleared out the rest of it.
Oh, you already did. Oh.
So this is a curette here. And that just helps scrape down the wall like that. See how that's coming out there. There we go. That's the rest of the capsule there. So now I just want to make sure it's completely clean. So I'll just use this a little bit more. Make sure I don't have any edges that are there. And you can see, if you could appreciate that capsule before, if you look at this now, there's nothing that's there. There's nothing tissue that's there. So now we'll just put in a couple sutures. Now again here, clearly we don't need to put in dermal sutures because this is minimal tension. And these are just for the residents that are watching. This is 5-O-proline. So this is not a dissolvable suture. These will have to be taken out. And I clip these fairly tight just because it's on the face. You don't want to see them a ton. And again, we've talked about ideal distance between sutures, So most commonly, most areas you're going to be working with, you talk about 7 millimeters. Usually with the face, almost pulled through too much. What I have to do is use the same spot. There we go. So we use 7 millimeters on most areas, but with the face, and see how that lays flat there? Just like that. But in the face, oftentimes we'll make them closer, and sometimes add 1 or 2 extra just because they're going to come out quickly to minimize scar potential. Then we'll leave that there, and those should come out nicely in about 5 days. All good.